82 attendees, 10 panelists. It's a beautiful Friday morning here in Maine. And to start us off today, Bajette is going to offer us a welcome.
Yeah, so welcome everyone. I'm a little bit more prepared this time than I was last time, so I do have something that I am going to read this time versus from speaking from my heart, but it also comes from there. I personally look forward to when we can meet together as a group, because the positive energy that is experienced when we're together is not comparable to not being able to see your faces and just knowing that you can see us. So I look forward to that day, and it will come. Last night, I was laying in bed listening to all the incredible sounds of nature, and I was wondering how I found myself to be in such a beautiful place, such as Fernwood Cove. 18 years ago, I accepted the call to adventure and travelled to Maine from outback Australia to the other side of the world. Little did I know that summer camps in Maine would transform my life. Today, I am so incredibly proud to be a part of Maine Summer Camps. Maine Summer Camps is and will continue to support camps during this difficult time. As each camp is unique, so is the reasons behind its decision to open or suspend or to alternate their programming. Our strength as an organisation is in supporting each other, and we need to put that at the forefront of our minds. Our strength is in supporting each other. Now that Jim and I have come to a decision based on our particular camp circumstances, I will say I am more at peace rather than in that emotional turmoil of limbo and uncertainty and the unknown. We have turned our problem now into a project. Whether you have chosen to open, suspend, or change, or are still undecided, I encourage you to turn your problems into a project. This has helped me to have a direction and to continue to be motivated with what I am doing. The Summer Camp Task Force Committee has acknowledged and recognized there may be challenges such as campers from closed camps choosing to research and enroll in camps that continue to open this summer. We ask that you treat this as professionally and respectfully as possible and continue to support each other as parents will make needed and informed decisions as they go forward. Not all states in New England or the country have remained so respectful to each other. I ask that we continue with this and this high level of integrity that Maine summer camps have for each other and continue to move forward in the best interest of the camping movement that positively impacts so many for a lifetime. Maine Summer Camp will continue to be integral in supporting all of our membership camps, and today is just one of those examples of trying to meet that. So thank you everyone, and we will continue with our meeting.
Thanks, Bajette. So just some quick housekeeping. This is a fairly short meeting. The general portion of this morning, we're scheduled to run until 11:15. So from 10:30 to 11:15, we'll cover a few areas of general interest. And then starting at 11:15, we're going to have Dr. Laura Blaisdell joining us for almost an hour, and she'll be able to answer questions for day and resident camps that are opening this summer from 11:15 till 12:10. And then Bobby and Terry and Steve and Laura are going to facilitate a discussion for the resident camps that are opening this summer. And then about half an hour after that, around 12:40, we'll have the day camps discussion, the specific day camps discussion to that. So the general portion of the meeting for the entire membership is fairly short. And then we go into a long stretch of discussions after that. And then we're planning, I think Bajette and Peter will talk a little bit later about what we're planning for next week's next town hall for camps that are closed or closing. So with that being said, Ron Hall, the rising media star of Maine camping, Mr. Ron Hall is going to give us an update on all his goings on. Thanks, Ron.
All right, thank you, Matt. First of all, I want to thank all of the camps that have referred media to me. I sort of want to thank you, actually, but anyway, I do thank you. And I think it has really helped us have a very consistent message about Maine camps. And I especially want to thank the camps that I have asked to go on record, as a lot of times when I'm talking with the media, they will want a specific camp that is closing or opening that they can interview. And you have all been stellar, and I really thank you. And I have to admit that I can't wait for the press stuff to end. And I know Betty is facing exactly the same situation that we are. So far, we have 72 camps that have publicly announced that they are suspending regular camp. A number of these camps are looking into doing creative things to stay connected with their staff and their campers. They're also looking at other ways to use their camp this summer. The one I hear most often is finding ways to deal with local children in day camp kinds of settings at their camp. And then we have some that are going online and are doing a variety of sort of formats for their camp this summer. And then we have a few of our camps that are continuing to serve their communities. And one shout out in particular, it would be to Norm Toms at Metuana, who has been doing an amazing job and is serving, I think he said 1,000 meals a week, 2,000 meals a week, I've been corrected. And I know at least one camp has donated a lot of food that they had at camp to Norm, not so much for the meals for the ones they're sending out to families, but he has a staff there that has been working nonstop with this project. And I also know Kiev and Wavis have been doing similar work. And then Bryant Pond has been putting out field packets that families in town can check out and go out and have a fishing packet or a bird watching packet or a number of other things. Again, it's great to see camps trying to engage with their local community with all that is going on. We have, from the feedback I've received, it looks like we're going to have about 20 overnight camps that will be operating this summer with a somewhat shorter season. At this point, I have not heard from many of the day camps. I know of right now 4 day camps that have said they are definitely will be open, and probably 4 that have said they are not opening. So for camps that are opening, I just want to remind you that there is a Bob Ditter workshop next Wednesday at 1 o'clock. And Bob will be talking about, well, I'll read it. Understanding and working with mesh, mentally, emotionally, social health issues in campers as a result of the impact of COVID-19. If you do decide you can operate safely, Bob will help us understand what we are likely to be dealing with our staff and campers who have been sheltered in place for months, who have been terrified of losing a parent or a grandparent, and who have been deprived of the natural stimulation that comes from being with other kids, who have, as we all have been, living in the absence of presence. Anyway, that's next Wednesday at 1 o'clock, and there are links to register in the Hall Monitor and also on Facebook. And then for the camps that have decided to suspend the 2020 season, we will be having a Zoom meeting next Wednesday at 10:30. And more information about that can be found in the Hall Monitor. And then finally, it's one of the ways that camps who have suspended can help the camps that will be operating this summer is we have a, again, it's in the hall monitor. I will update it. The next hall monitor I send out, but it won't be this week because I can't do 4 in 1 week. It is staffing needs that various camps have. And if you know of staff that are looking for a job now, I encourage you to share that with them. And with that, I think I'm done, Matt.
Thanks, Ron. And I'd just like to point out or remind everyone that when we're talking about these meetings, Bob did a webinars and stuff and saying, you know, for camps that are open or closed, of course, every MSC member is welcome to attend any of those webinars or meetings. And in fact, we encourage all members to make as many of those as possible, but we understand that everyone has a limit to how long they can look at Zoom. And so just sort of starting to narrow the focus of some of these meetings, moving away from general topics to more specific topics. Steve, did you have something before we kick it over to
Looks
Betty?
like it was just solved. There was a question to clarify if Ron meant Tuesday or Wednesday on the camp suspension meeting, and Brigitte posted that it's Tuesday. Thank you.
Thank you. All
Yeah.
right.
Sorry,
Brigitte, go ahead.
Yeah, in the hall monitor, I just cut and paste what was in the last one into the chat. So hopefully that keeps us on track. Thank you.
Thanks, mate. Now giving us an update from the view of ACA New England is Betty Bussell. Betty, thanks.
All right, I'm going to give you a quick flyby on what's happening in the New England states. Rhode Island has approved and is allowing both day and resident camps to operate. They have not come out with specific additional guidance for them, but supposedly it's coming. Connecticut has allowed and does have guidelines out for day camps. They have also determined that overnight camps will not be able to operate in the state of Connecticut this summer. Massachusetts has been never mind. Massachusetts, we're still waiting for guidance. Just, you know, even after multiple calls and everything else, as you can imagine. So still waiting there. Vermont day and resident camps are allowed to operate, but they are still waiting for guidance. And New Hampshire is another one we're waiting for information on. We believe that some written things are now with the health department, and hopefully that will come out soon. I will say that every day that goes on for camps, whether they have guidance or not from their states, there are more camps suspending their in-person seasons. It will be challenging, I believe, in some states where people are looking to camps either for childcare or kind of opportunities for their children to kind of be out of the house and going. But it's just kind of where everybody is now. It's tough for everybody. But I know that people who have already made a decision one way or another are feeling better than being in limbo. So that's it. Thank you.
Thanks, Betty. Next up, Peter Hirsch has an ask, I believe.
Good morning, all. If those who got on a little bit before 10:31 were able to hear all of the banter among these esteemed panelists, I hope it didn't shake your faith in how on top we all are of all the things we're trying to do for us and on your behalf. And I'm going to try to stay. As a panelist with this face, the beard will be gone soon, as my wife Roberta assures me, but apologies that I won't be able to be here all the way through to the end. I will say now that the guidelines have been approved and presented and formalized, I think that Micah's shift is going to be a little bit more to the traditional roles of how we can support every member of this industry, regardless of the decisions they make and will continue to make. And everything that we can do to support the industry at the moment, starting at the federal level. So we have been in touch with the congressmen and senators' offices, and we're going to continue to do that as at the federal level they consider legislation to support industries throughout the country and into the state of Maine. So yet again, if anyone has personal contacts with people in those offices, we want to contact them formally, as Ron has done and will continue to do, but we also want to use whatever informal connections we can have as well. We will also shift to the governor's office at the point where they kind of get a little further down their checklist list, because they're still focused on that. But when they begin to finalize that piece and are thinking more about what they need to do for the state and industries, we will be reaching to the governors as well. And then the last piece will be state legislators, and that will probably not be until August and September when that session opens. So certainly keep through Ron or myself, any contacts you have, but in that order, from federal to members of the governor's administration to your local state legislators. And hang in there, everyone, and till next time.
I mentioned one other thing here. ACA nationally is also working on that on the federal level to find some help for camps, small businesses, etc.
Thanks, Peter. Thanks, Betty. I apologize for the sound of lawnmowers outside my window for everyone. Next up, we have Jack. Did you have anything for this portion of the meeting? Was there any specifics you were going to mention to the general membership as a whole?
No, I don't think so at this time, unless they're, I guess, of course, available during the question and answering period.
Yeah, okay. Unless any of the other panelists have anything they want to add right now, I think we were looking to reserve the rest of this time until Dr. Laura joins our call for a question and answer period. Panelists may or may not be able to answer, so if anyone has any specific or pressing questions, if you want to either throw them in the chat or put your hand up, and we can unmute you so that you can ask any questions. So like I promised, a pretty short general meeting here until we get to Dr. Laura at 11:15. So we have a chance, if anyone has something that they'd like to ask or something they'd like to share, now's a great time. So Steve Lepler, g'day Steve, neighbor of ours over in Parsonsfield, saying, is there any info about upcoming changes in the PPP forgiveness guidelines? Bajette or Steve or Jack, is anyone
I have been in the process of filling out a draft version of the PPP forgiveness application. So there's a lot in there, and we're going to be probably discussing that definitely on Tuesday. I believe we're going to be discussing the PPP. Yes, said Ron. So on Tuesday at 10:30, maybe we can have some more specific information for you about the PPP. And if there is specific questions, I know they're still releasing guidance. I received an email today from someone saying that they're still trying to clarify, which makes it very difficult when you're trying to make decisions based on payroll based on what utilities are included, to make the best benefit for your business and the position you're at. I've been trying to make those decisions, and I've been communicating with the bank that I went through in order to get my SBA PPP. So that may be a resource for you to reach out to whomever you went through, who can give you more guidance, because they are the people that are getting that guidance and have access to ask the SBA questions that you may have. So I've had a big conversation yesterday with my banker, and it went really well. I had a lot of questions, and he has been getting back to me, which I appreciate.
Let me just add that
Right.
I think it was yesterday. You can't ever tell in this nuttiness, but I think it was yesterday. They published new guidelines for PPP forgiveness, and they're on almost everybody's website. You'll find them. So check there for your latest guidance. And that's on forgiveness of the loans. That's the important piece now.
Thanks, Bajette. Thanks, Jack. Brittany is asking a question. Is there any specific guidance out there regarding climbing walls or challenge courses? And I'm assuming that's COVID and COVID sanitation questions probably. So does anyone want to put their hand up to have a crack at that question? Laura, good on you.
Our understanding is there's going to be something in the ACA field guide if it's not there already. But in general, there haven't been, and maybe I should back up just for a minute. We've got 3 different documents we're dealing with for guidelines, and I know this is going to get confusing overall. We have CDC guidelines that came out this week for day and summer camps. We have the ACA's field guide for day and summer camps, and then of course we have the state of Maine guidelines for day and summer camps. They're all similar in the sense that they all start with the statements that these are recommendations for you to implement in practical and reasonable ways in your own facility. But then there are some differences moving along. One thing in the main guidelines is there are no on-site activities that are specifically prohibited, such as climbing towers or ropes courses or a climbing wall. And we didn't see that also in the CDC guidelines. There were no actual activities that were on-site prohibitive. They do have a list when you start implementing off-site activities. So mostly things like a climbing tower or climbing wall will be held to the same level of guidelines in the ACA as their other activity recommendations, which is you need to demonstrate that you have a policy for cleaning and disinfecting that activity site, and it needs to be at good, better, and best. And so some of those different activities you may choose not to hold on your camp, on site at camp this summer, because you're not able to keep it clean and disinfected at a level that you're comfortable with. But again, from the guidelines, they didn't actually go through each individual activity. They just gave some overview, and then they ask you to apply it to your particular facility.
Thanks, Laura. Steve?
Matt, if you don't mind, I'll try to answer 3 or 4 or 5 of the questions that have popped through, and there's way more than that, but I'll do my best to.
That would make my day, Steve. That would be amazing. Yeah. Thank you.
I'll knock a few out, and then I'll put on mute, and somebody else can knock out a few more after that. Reed, can staff come to camp midway through the summer under these guidelines? The ultimate answer is yes. You have to feel comfortable with how you're going to handle staff entry. Regardless of whether you're a multi-session camp or a single session camp, there's an expectation that staff are in quarantine for 14 days prior to camper arrival. That might sound confusing to you. If you're asking about staff arrival during camper in session, you might need to figure out how to weave yourself through that restriction to make sure your staff that are arriving are quarantined. Jane Lickman, can household rules be relaxed after 2 camper weeks so we can act as a bubble community? Again, let's just take this into the concept of there are the overlying and complete overarching concept is to keep your groups in the smallest practicable group sizes that you can in order to accommodate the safest process you might be able to consider for your facility. So that's going to be a question that you have to circle back to yourself about. There's the best, and Dr. Laura will probably get into this later when she talks. There's going to be always a best and a good and a better and a best when you take a look at some of the decisions you're trying to make. Can you, in effect, Jen, can you loosen? You need to circle back to yourself on that to decide how that works in your community. Jeff Newman, what's going to happen to our kitchen and support laundry staff that come on J1 visas? You're right. Yeah, you should probably go into contingency planning on how you're going to staff some of your key support systems. If you are relying essentially and only on J1, you should probably start thinking about seeking a way to support that reliance. And there may be a good set piece here for camps that are striving to open to collaborate together. I'll throw Ron, I'll throw this at the wall to Ron. Maybe there's a way that we can help collaborate effectively as a Maine Summer Camps member group to help people that are trying to figure out how to do this. Sean has come up with a few other questions. Why did the state require 2-week camps from out of state? And do we have a definition of quarantine for pre-camp attendance of out-of-state campers? Pre-camp attendance, okay. Sean, the overarching 2-week camp for out-of-staters, the determination was made by the state early on that they didn't expect any vision at all for any program shorter than 2 weeks. Ron Hall pushed back on them last weekend about, well, what about, and that had a lot to do with the quarantine entry into the state rule. Ron Hall pushed back on that specifically for the camps that serve as Maine children with Maine staff, and said, would there be considered an exception made for that? Because they're already Maine residents, they're already here, they're already in the governor's order. And the guidance accommodated that. It's probably not the answer you wanted to hear, but that's how they went with it. Seth Johnson asked, what's the primary difference between running a single session camp and a multi-session camp? That's a great question, and they are scattered through the document. And there are differences. I'm not going to try to answer that question on panel online at the very moment, but there's probably a way for us to summarize that in some way, shape, or form and get it summarily posted, would be my guess.
Steve?
Yep.
I'll add into that there is one area that there has been confusion for multi-session camps, and that has to do with where it says camps must adhere to gathering size limits as established by the governor's executive order. A lot of camps took that as meaning that you cannot have a camp of more than 50 campers and staff in multi-session camp. And I reached out to the state and they said, no, that's not the case. It has to do with group sizes within your camp. So you could have 4 groups of 50 and that would be fine. The other thing, Steve, you were referring to, we do have something on our, in the hall monitor for camps that are looking for staff to fill out, and then I am sharing that with all of our camps because we have camps that are closing, but we also have camps that may be open that have extra staff, and they can be referred on to camps in need.
Thanks, Ron. Matt, I'll tackle one more that might answer a couple at a time.
Yep.
With one just comment. There's a few questions that are popping around the concepts of what do you do for pre-arrival and what does quarantine really mean? And in some ways, take this part and then get in. Again, I recommend that anybody that's listening reads the document, right? Don't just rely on us. There's recommendations for people coming from out of state to self-screen, but that's both camper and staff, for a period of 7 to 10 days prior to arrival, and to show and hand in that self-screening document. I believe that there is actually a tool on the American Association of Camp Nurses that could help you with that template. That's a self-screening assessment tool.
And
In
Steve,
addition-
ACA has that in the field guide also.
Great.
And it's also in the hall monitor that just came out yesterday.
And that's the one attached to ACN, right?
Yes.
Yeah, okay. And then on the 14-day quarantine at home before arrival, if I'm not mistaken, and somebody can shoot at me if I got it wrong, but I think that is specific to coming from areas of high transmission risk. And I think I'm gonna get a glass of water.
Thanks, Steve. Laura, can you answer a few of the questions that are popping up about staff training, and I think particularly looking for those staff trainings that lead to a certification?
So staff training is something that information is still coming out about. For example, there's nothing in the main guidelines about staff training. There's very little in the CDC guidelines, and there's more resources in the ACA field guide about staff training. Betty's let us know previously that ACA New England has different resources, and there's a resource page for this. Basically, it's breaking down generally into 3 main groups. You can do online training either before or while your staff is on site. You can hire someone to come in to your site as long as they maintain physical distancing and properly protect themselves if they are teaching to a group. Both of those first 2 options also have the benefit of certain certifications are going to be either extended or waived, and we've been trying to keep up with those through the American Red Cross and some other certifying agencies. The third thing to remember, and I think this is an important concept for not just staff training, but for many things as we move forward, if you as a camp are able to demonstrate that you have thought about this situation and that you are adhering as close as you can to policies and procedures, but also having to adapt based on the current situation, you can do that. And we're trying to get more clarity about that, but that's going to be your best protection, as Jack earlier says. Make sure you write it down and you explain it. But I gave this example yesterday to a camp director I was speaking to, which is, you know, my daughter's going to be an archery counselor this year at camp, and she's not going to be able to attend an archery certification course. And so she will demonstrate that from being a Winnegonnick camper for 10 years, what she learned in archery, and then she will go through some online training, and then she will, in addition to that, train with one of our certified but not instructor level trainers here at Winona. And that's just how we're going to try and get everything put together in a non-perfect world to demonstrate we have thought about this issue and we're doing the best that we can under the circumstances.
And you know what I'm going to say, don't you? Make sure you document it. Write it down or
I even put that in there, Jack. I said Jack earlier says to write it down. I think Bobby said.
Brilliant. Do any of the other panelists want to take a crack at any of the questions that are popping up? I will also say to all the attendees that the chat there's been people sharing a lot of good resources in the chat. So take a look through and see if your question's answered there. And then I see Mary Ellen's got her hand up. So Mary Ellen, we love your picture. Did you have a question?
Yeah, you don't really want to see me. What I wanted to tell people was, not this morning, not well. What I wanted to say was that about ropes courses, there was and challenge courses, there was a document that came out yesterday on the ACA Connect. You can find it at the alliancecollaborative.com. I put that in the chat, COVID-19 resources. It's a like 30-page guide to all the issues of reopening, whether it's a ropes course or a commercial site like Monkey Trunks. But on that page, there's also a pile of resources around cleaning and disinfection, which I know has been a big question for people who have those courses. And I would just direct folks there. I think you'll find a lot of helpful information.
Thanks, Mary Ellen.
That help? Yep.
Yep.
Yeah.
Steve, can you answer the question? I don't know, maybe you already did. The guidelines aren't clear on international staff coming. In one spot it says they can't come, in another it says if they're allowed they need to quarantine. Is the second part only for full-time international staff? I'm not touching that one with a 10-foot basketball.
Sure. So I'll do my best. We found a place where the state guidance conflicted itself. Page 1 says one thing, page 3 says another. I'm not the lawyer, but if you're planning on opening, page 3 looks a lot better.
Steve, I can comment too. What you see on page 3 is one of the items I submitted to the state asking if they would change what they originally had to saying if the CDC allows people to come into the country. And so they put that in. My feeling is they just didn't think about the fact that they forgot to take the other one out. But clearly they had agreed with us.
I agree. I vote, you didn't hear it from me, but I vote for page 3 based on what Ron just said. We went back and we said, are you sure? And they said, sure, okay, we'll change it. And then they didn't change page 1.
We have a couple other typos and edit issues. So for example, page 1 still does say that overnight camps are in phase 2 when it should really be reading phase 3. So there are a couple inconsistencies in the document still.
Elizabeth asked a question that I think we can maybe answer. Have the state health department requirements for camper and staff health forms and immunization records changed?
I'll try to answer that. The first answer is I don't know yet. I have been reaching out to DHHS this spring, and basically they say that they don't know anything at this point. I know one camp contacted them about questions on the guidelines that the state put out this week, and DHHS said we had nothing to do with the guidelines. So I will continue to reach out and get clarification. There are questions about water testing. There are a number of questions, and I will try to get whatever answers they're willing to provide.
Thanks, Ron. Bob, I can't read the full name. Bob had asked a big question about campers coming into the health center or the medical cabin at night with a fever and how that's going to be treated. I think that's a perfect question for the next couple of segments of the meeting that are going to start once Dr. Laura joins us. I think those sorts of questions are best going to be answered in that format. We had another question from Rich Deering. Hello, Rich, who asked what organizations are actually going to be in the field this summer for oversight of our camp program. So DHHS, or who's going to be out and about looking at us this summer?
That is another question that I have on my list for DHHS. I mean, ACA, I think, has already said they won't be out there. Is that right, Betty?
Yeah, the DHHS is the licensing organization of camps. They're the ones that we will expect to see this summer. And I would suggest to you that when you find a weirdness in these latest state checklists, you probably are better off going back to the original source, for example, with regard to water or with regard to reporting diseases, because those have been written in the calmness and the saneness of the organization of bureaucracy, and not in this thing has kind of come out of the nuttiness of this. So I think you're safe when you have there's a discrepancy between the checklist and what are in the normal regs and regulations. You're probably safe sticking to those, but Ron obviously is trying to work to get that lit up as well.
I just have a question. So camps that are not opening, should they reach out to their DHHS representatives, like health inspection program, and say, oh, we're not operating this summer, so you don't need to come out? Or
I think that's an excellent idea to do, because they've got enough problems themselves, and they would be delighted. And we have a good relationship with them, and we've always tried to encourage them to reach out to us about inspection. So I think it would be a really great idea to reach back out and say, you know, we are not opening. What do you want to do with regard to that? We should encourage that by Ron, by every camp. Maybe put it in the hall monitor or whatever.
All right. And again, I'll also ask DHHS about that too.
Right. We have Robert has had his hand raised. Robert Benton. So I'm just.
I just wonder.
Oh,
I wonder
sorry.
about
Bobby, you go ahead.
letting anyone. Oh, sorry. Just wonder about letting anyone in the gate anyway, whether they're there to inspect or what organization. I wonder how we do that anyway, because of course we're starting our policy that our gate will be manned 24 hours a day, and really letting no one in that's not part of the community. Is that being addressed anywhere?
Yeah, no, not yet, but I am guessing that DHHS, if you know, they're obligated to inspect, so I'm going to guess that we're going to get something like they're going to be face masks, they're going to be screened, they're going to be, and they're going to, and maybe it's even going to get to the point where they're going to have to call us and make an appointment to come and see us, which would be really great.
But Bobby, let us know how it goes when you turn them away.
I will. I promise. I'll film it. We'll document it according to Jack. No question.
We probably only got a couple of minutes before Dr. Laura joins us, but Robert Benton and Jeff Newman have questions. So Robert, are you there? Are you able to? Did you have a question or a comment for us?
Yeah, hey Matt. So Robert Benton here from Acadia Mountain Guides. I just wanted to go back to the climbing wall sanitation and just put it out there that we've made some really good and really purposeful procedures for climbing gear and sanitizing that stuff. So if people would like to reach out to us and hear what we have for procedures on how to safely manage sanitizing ropes, harnesses, and such, that would be awesome. And yeah, that's all.
That's brilliant. Thanks, Robert. Appreciate that. Jeff, are you there? Are you able to? You had a question or a comment, Jeff Newman? Maybe not. Okay.
I tried to answer one of Jeff's questions by type just now, Matt. I don't know if it succeeded or not.
Okay. May have done. It looks like there was quite a few, you know, the questions about quarantines, and I think a couple of the others about.
Hello?
Oh, that's Jeff. Hey, Jeff.
And Bobby, in answer to you, thank you for everything that you guys are all doing. Bobby, in answer to your question, I actually spoke to Lori Davis, our good friend from the health department. She already has her schedule. She absolutely plans on making visits. She said she even told me she's not coming to Indian Acres, but she will be at Forest Acres. So I don't know how she's going to do that, if she's going to come in full regalia and PPE or what, but they are, I mean, look, everybody knows her. She wouldn't say it if she isn't planning on it. The second thing is, and it's really just a point of information question, to me, the biggest challenge is if one of our kids that doesn't live within driving distance turns positive, what are anybody's suggestions in getting that child home? Driving wouldn't really be an option if it's more than a one-day drive. We're exposing the parent who has a higher risk. Where do they eat, sleep? Multi-day drive, flying would not be an option. Self-quarantine in Maine for 2 weeks, that doesn't sound like an option. We don't really want to keep that kid for 2 weeks in self-quarantine at camp. Does anyone have an answer for that?
Steve or Laura look like they're keen to have a crack at that question.
Steve goes first.
So thanks, Jeff. I tried to help with a typed answer just a few minutes ago. You do have the ability to refer to your own controlled disease plan, and you will have an isolation plan built into that. Therefore, you can make the determination if you are willing to isolate somebody for the duration of their sickness. I will definitely defer and refer to Dr. Laura, who just popped in. Thank you. It's 11:15, and let her continue on with that concept. It does not answer your question on what is the alternative to doing that, but you do have the ability to create your own plan that includes keeping people on site.
Okay. Dr. Laura, do you have any other suggestions? Or were you able to hear the question, or were you in the middle of kind of coming on and go?
I was in the middle of coming on, but essentially the question is, what do you do with presumed suspect COVID or COVID positive campers? Is this correct?
No, it's more a case of if a child, which all of us have, I assume, is coming from a non one-day drivable distance, and basically how does the parent get them home? Because it's not safe for the parent really to be exposed to the child. They can't fly, publicly fly. They can't, and then Steve said we can elect to self-quarantine that one child, but it is a valid question as to what we're going to do if they're not within driving distance.
So, first of all, just to be clear about terminology, so isolation is what we use for kids who are sick and they need to be isolated. Quarantine is what we do for people who are healthy and they're keeping away from others to make sure that they remain healthy. Right. So if you need to isolate a child, camps can take a variety of approaches. You could consider that you are going to have an isolation ward for your kids who are suspected to be positive or confirmed positive. You can then work in any case, because you're for overnight camps, at least, you're going to have that location anyway identified. So then you could continue to keep that child on camp. Our current isolation guidelines are 10 days that they need to be in camp. The vast majority of children have very mild symptoms, so they're going to be bored in that area. So you're going to want to figure out how to entertain them as well. Right. if, you know, my take right now on parents is that in this world of extreme psychological distress about a pandemic, you're going to work one-on-one with each parent and ask them, you know, how should we proceed here? If they can't get to you, you know, because they live in a multi-state, or it's going to take a couple of days to get to you, you know, so be it. I think working with parents to say, okay, what day can you show up? And then, you know, figuring out how to get a kid home when they need to be isolated is tough as well. In Maine, we know that we have a 14-day quarantine for well people. So this would be a quarantine for the parent and an isolation for the kid. They could find, you know, a hotel room or someplace and stay in Maine and until they meet the end of their isolation period, and then leave directly after that. None of which are ideal. I understand.
Right. In talking to my camp doctors who are pediatricians or internal medicine doctors, they were concerned that whatever isolation facility we have, they are not comfortable, so to speak, having an isolation ward, if you will, because every kid has different viral loads, and they felt that it was irresponsible to isolate an asymptomatic kid with full-blown COVID symptoms. In other words, like, our original plan was, okay, we have the designated COVID cabin or COVID health center, and it's separate from our regular health center. But, you know, her point was that they all have various levels of viral load, and that it's not prudent to put a low viral load in with a high viral load. And we have no way of knowing that.
Well, Jeffrey, I have not heard any scientific evidence to say that you shouldn't be cohorting kids who are ill together. A sick kid is a sick kid, and being next to a kid with a high viral load is not going to change their presumptive positive or their positive test. But you know, I appreciate that you're hearing multiple opinions from multiple people. And so, you know, every camp director has to make their own decision about what they feel comfortable with the advice that they're given. Right. And so if that is the medical advice from your medical team, then I suggest your camp begin to figure out how you're going to get kids home. Garth Altenberg suggested having a friend or a family member identified within an 8-hour drive for each camper, or identifying that person, you know, once as part of the preparation for camp. But I would say that there is no, I have not seen any evidence to say that you can't cohort children together as they're recovering from coronavirus. I think a lot of doctors use the hospital as their guidance. And again, I reiterate again and again that a health center is not a hospital. It's a health center and a camp, and it's essentially an extension of a family home. So if my two sons both had coronavirus and got sick, I wouldn't put one in a different house from the other. I would try to separate them as much as I could in the house so that they could, you know, convalesce. But I think that it's important for physicians, when they're thinking about camp health centers, to be thinking about them as an extension of the family home and not an extension of a hospital.
Thanks, Laura. Jeff, thank you for the questions. And I think it's been a good segue between our earlier portion of our meeting and the next 45 minutes or so that we've got Dr. Laura on the call with us. So officially to welcome you here. I'm sure you're insanely busy right now, Laura, and so thank you so much for making the time for us. Do you just want to take over now and sort of run through and see what you are pulling out of the guidelines, or do you want to just field questions? Is there anything in particular that you want to lead off with and sort of bring up and call people's attention to?
Oh, thank you. It's a beautiful day in Maine, so let's focus on that first. Take a deep breath, and if you're in Maine and you can get outside and get some vitamin D, let's do that. We can put questions in the chat box. I think maybe what I'll start off with is, let me start off with three things, and maybe it'll be a way to get people starting to think about what questions they want to ask. So first of all, for camps who are, I guess I just want to say, as I've said always, that my goal is not to push an agenda about whether camp should open or not. That's not my agenda. My agenda is to say, if a camp decides to open, how can we do it in a way that's the safest possible for everybody who's there? So I want to first of all say that, and I know that there's a lot of strong feelings about whether camps open or not. And I would, I just acknowledge that. And I don't think it's a question about ethics or irresponsibility. I think it's a question about, are you prepared to do what's necessary to maximize your public health and communicable disease plan this summer? So on that note, switching to communicable disease plans, I think it's been important for people to understand that there is no one mitigation factor that's the be all and end all that's going to keep cases from spreading in camps or showing up at camp. There's not just one. It's the overlay of multiple public health measures that are well known that are going to keep camps safe from kids this summer. So when we think about the different factors that we can use to mitigate spread, there's screening, and testing can be part of screening, although it's not recommended at this point. And we can certainly talk about testing more, but it's testing and screening. It's using these sort of small, consistent circles of children, small, consistent groups of children, and not allowing mixing between those. I use that terminology. I use concentric circles of infection spread, or just concentric circles. That's the term that we tend to use in public health. There's physical distancing, there's face coverings, there's hand washing and decreased face touching. There's doing outdoor activities as opposed to indoor activities. There's the use of quarantine and early identification and isolation. And again, all of these different measures, none of them is perfect. And that's why we overlay them one on top of each other, whichever ones can, the most that can be practically done in a situation. That is how you can put together a smart infectious disease plan for your camp this summer. So I just want to again say that it's not just one. You're not going to be able to test your way into certainty or test your way into feeling better about your summer. You're going to have to do all those other aspects as well in your camp setting. And then I think I'll also just say there's a lot of chatter out there about the guidelines that have been available, not only from the ACA with the EHE field operations guide, the Maine state guidelines, which came out. I know that everyone has looked at them closely on Wednesday, and then this new considerations document that's come from the CDC, from the federal CDC, which certainly has some concerning and perhaps not scientifically based recommendations. We're working on a national level to work with the CDC about our concerns about their risk levels of camps, particularly two issues in regards to that kids from out of state are at particularly high risk for overnight camps, and that when kids are identified as positive, they must be sent home. Those, I think, are the two major sticking points of what we look at the CDC considerations. When we've brought these concerns to them, they have said, thank you. We tried our best, essentially, and just remember that these are considerations, and your state guidelines are the ones that camps should be looking at, but these are just considerations. So we're still working with the federal CDC to clarify why they decided to do the risk stratification that they did. But again, in any other year, the federal CDC guidelines would be the Bible that we would turn to tell us how to run camp this summer. Unfortunately, this year, the federal CDC has decided to put out considerations and not guidelines. I think the concern there is certainly, Jack, I see is on the call. I think people ask all the time, you know, well, what is my legal risk if I open camp under the Maine state guidelines, when you see a CDC consideration that says it's a higher risk to take kids from other camps and or from other states, excuse me. And I think, you know, to that, I've heard multiple lawyers, and Jack, you just pop right in and cut me off because I'm not a lawyer. But I've heard people say, make your communicable disease plan and follow it. Do what you said you're going to do in your communicable disease plan, and that's going to be the best method that you have to prevent, to mitigate your legal risk. So I don't know, Jack, if you want to pop in and say anything more on that at this point, and I'll check the chat box and see if there are questions I can take, if that's okay, Matt.
That would be great. There's some questions in the chat, and I've been pushing people to please move their questions over to the Q&A because I'm starting to lose track in the chat. So yeah, you can check either place, whichever takes you.
Okay.
Let me just say that Laura is right on, that you should pay attention to the state guidelines, and that you should develop your own plan. You should document what you're doing. It should be consistent. The best line I've heard so far is say what you're going to do and do what you say. Do what you said you were going to do, and I think that's safe, as safe as can be. I think that the federal guidelines, as Laura has said, have been incredibly weak, and I look to the state for the liability issues and your own guidelines.
Thanks, Jack. The first two questions in the Q&A talk about what is this shutdown? How far do we get into numbers of cases before the state would come in and shut down? So this has been a question for many states. Some states have been battling, 3 cases and the state would shut you down. Luckily, we've been able to talk a lot of states back from that. I think we are very fortunate to live in Maine, to live and work in Maine. Our Maine state government has extreme respect for camps and the safety measures that you put into place. Also, our state has experience working with camps through the H1N1 season. And if you did operate during the H1N1 season, you can remember that no camps were shut down by the state for the numbers of cases that they had. There's a paper that I wrote with the state about examining pandemic response to pandemic H1N1 in 2009 that I'd be happy to share. But again, the state did not historically shut down camps at that time. And I can't say what would be done in this situation, but Maine government and the Public Health Administration in Maine understands how different camps are from long-term care facilities or other congregate settings. So I think it's important to realize that there's no number, but if you do all of these sort of mitigation, infectious disease mitigation interventions, as I suggested when we first started, you're gonna keep your cases under control. They're not gonna get too out of control, I would think, if you appropriately employ those recommendations. Are there any day camp multi-sessions requiring documentation for pre-screening and 14-day quarantine? Should parents sign a waiver to release camp from liability if they open and follow the CDC protocol? Matt, do you know of any day camps that are allowing multi-session day camps that are requiring documentation for pre-screening?
I don't think I'm the right one to answer that question. Any other panelists have an answer to that regarding documentation of pre-screening for the day camps?
So I guess I would just say, go ahead.
Day camps, Laura, day camps are mostly Maine, and in the state guidances are discussions about, having Maine children and using Maine staff. Laura, you got something more?
No, I think that the main state guidance really looks at if you are main staff and main kids, you don't need to quarantine. I think that any camp that's opening this summer has to think and ask those who are coming to your facilities if they can use their utmost care prior to coming to camp. Camp this summer and this is my opinion, but it's a luxury and it's not a right. And asking the families at your camp to do some sort of pre-screening. ACN, the Association of Camp Nurses, has a great pre-screening tool on their website. And I think it's appropriate to ask the kids or the family to moderate their behaviors before they come to your camp.
Laura, I can add into that.
Thanks,
I'm
Laura.
sorry.
Go ahead.
Jump in. Recommendations for day camps, page 3, section G. It says monitoring and preparing. Number 2, implement screening safely and respectfully, as well as in accordance with any applicable privacy laws or regulations. Confidentiality must be maintained. And then number 3, camp directors may use examples of screening methods. And then they have a couple right there. So it is an expectation that day camps are employing some form of screening.
And Jack,
Right.
can you just quickly chime in on the last part of that question, which was, should parents sign a waiver to release camp from liability if they open and follow CDC protocol?
That's a question that is different from every camp. For every camp, it depends on the program. I believe that a document that's part of the process of having the child come to camp ought to contain some language. And I think Ron has asked me to prepare a little document that lays out the requirements there. But each camp should really consult with their own lawyer about the actual language that goes into that document. But what I'll do is I'll put together an outline and we'll publish it in the hall monitor here coming up, or wherever Ron thinks it ought to go, and respond in that way.
Again, we've had feedback that going through your insurance company is also crucial. Steve's passed around one from Redwood's insurance that they might, certain insurance companies are going to require that you use their assumption of risk.
Yeah, and of course the difference is that the document you draft is an attempt to protect yourself against a liability, and the document that the insurance company wants you to draft is to make sure that they don't have to pay out. So you should remember to look at those documents with your different eyeglasses and make sure that you understand that their principal goal is not the same maybe as yours.
Great, thanks. So some questions from Pam. So face coverings about tubbies or buffs. I think any of those fit the caveats of face coverings. I think most people are recommending double thickness cotton, but I think the definition of face coverings is pretty broad at this point. I think it's important to remind folks that face coverings should only be used if they're age or developmentally appropriate, if it's appropriate for the activity, i.e. not swimming or boating, and we never put face coverings on people when they're sleeping or if they have respiratory problems with breathing. I think Pam also talks about physical distance, about transmission. So when we think about contact risk, or the risk of whether it be an activity or a risk of two people being in the same vicinity, it's 2 factors, and it's actually 3, but so 3 factors. One is contact intensity, which is proximity of individuals and duration of time that they're together. And then the risk of the activity or the event is multiplied by the number of people that are involved in that event. So whenever, as we look forward to determining programmatic activity risk or coming together risk, you have to think about duration, proximity, and the number of people that are going to be affected by that activity. So that's, and so physical distancing is a really big part of camp this year because of that proximity factor, as are the small group sizes. And so you're affecting both proximity and group size and decreasing your contact risk by using those mitigation methods. Stephen Bernstein asks, this is the National CDC website is over for camps consideration, realizing that this is only consideration, but we follow this, we'll be sending a lot of kids home. Any thoughts on how to use this consideration in practice? Staff and campers with symptoms at camp should immediately be separated and sent home, referred to their healthcare provider. Families of sick campers may follow the CDC guidance for caring for oneself and others are sick. So then, and then what do you do with the people who are in contact? So I think, Steve, you've outlined a nice plan if that works for your camp. I think for other camps, they will be keeping camp and staffers on site and not sending them immediately home. But I think we have to retain a nimble response to when people get sick at camp and in the decision to send them home or not. It may be feasible, it may not be feasible. You may find that kids are actually not as sick as you thought they were, and by the time you've made an arrangement for them to go home, they're raring and ready to go back into the camp session after they isolate. So yes, I think that, Steve, you've talked a little bit about how you can practicably do that in a camp setting. Bob asks, largest area of disconnect is the normal camp situation where a camper comes to the medical cabin before bedtime because they're not feeling well and have a small fever. 99% of the time they're dehydrated, and they'll give them some Tylenol and kiss them goodnight. And if it does not resolve the situation, if it resolves, the camper does not return. I've been told that we can no longer take that approach. We have to treat COVID as a possibility. This is difficult in a camp situation. Yeah, so I think this is one of the challenges of being of how this disease is manifesting in the pediatric population. It's vastly mild and hard to necessarily diagnose. So in the vast majority of children with coronavirus, if they're going to have symptoms, they're going to be fever and cough. That's going to be the major two symptoms that they're going to have. We are going to we could take the approach of every kid who coughs or has a low-grade fever, we're going to isolate. One of the advantages of camp is that you can watch kids over time. You can say, I'm going to hydrate you, and I'm going to give you some Zyrtec, and we're going to see how you respond in an hour. And then we'll make a decision about whether or not you're responding like you're dehydrated or responding like you have an allergy. I think working with your healthcare staff to talk about what their cutoff points will be really important. The other aspect is I'll go back to the multiple layered mitigation responses that we're putting into camp this year. So if we happen to miss a kid who's actually positive, we thought it was dehydration, we sent them back to their bunk. Their bunk is their household, right? And we're permissively allowing bunks to live like we do in our family households, without masks, without shields, without plexiglass barriers. So if we happen to make that decision and that kid does go back to their bunk, that was our best clinical decision at the time. That child, based on the mitigation factors of concentric circles of care, of increased daily screening, so you'll pick them up tomorrow morning if he pops a fever, the distancing between households, the face coverings if distancing isn't physically practicable. All of these measures are going to minimize the effect of that decision or that missed asymptomatic but positive camper. So it's a hard situation, I do realize, but the whole goal is that if that were to happen, given the knowledge that children are asymptomatic but still positive, we are minimizing their exposure to the rest of camp so that we can continue camp programs moving forward with the minimal amount of exposure. So it's a great question, very great question. Isolation area for suspect case have to be a bathroom and a shower for each person. I do think it's probably a good idea to have an isolation bath area for those individuals that's separate than your camp facility if possible. Kathy asks about running a camp program without a doctor or a mid-level on site. I think what you want to do is you want to have a medical professional on site that can tell you that if they think it's coronavirus or not coronavirus. I don't think that needs to be a doctor. I think a strong nurse practitioner or a very good, a very skilled RN could do that as well. I do realize that we are operating in a very high level of parental stress. And so each one of you feels that the need to staff your medical facility quite robustly. But for me, in thinking about camps, I really just need somebody to be able to say that's potentially coronavirus and I'm going to get you tested, or that's, I don't think coronavirus and I'm going to watch you closely. I think that's the skill set that camp directors need at camp this summer, and what you need to reassure parents is, as we all know, quite often a different thing than what we need on the ground. If you do not have the space to isolate campers, your plan is to send them home. In the absence of diagnostic testing with quick turnaround and a COVID symptom profile now up to 10, children will be presumptively positive for a variety of symptoms. We'll be sending many homes with no concrete diagnostics. I think that is exactly a different way to frame the same question about the difficulty in diagnosing coronavirus in the pediatric population. Hopefully we will have some testing capabilities that come back fairly quickly soon in the future. Water play question. Camps young children using sensory or water tables. So we don't have any indication that coronavirus is transmitted through water. We know that it is actually quite sensitive to the chlorination of pools and water. And we don't have any sense that it also spreads in lakes or ponds, including, I think the CDC has allowed for hot tubs and water parks at this point as well. Again, the concern is the physical distance between individuals when you're playing in water and not the water itself. I think it's good to remember, if I envision any water play that happens at our camp, there's a lot of screaming and shouting, and we know that sort of like forced exhalation of singing and shouting can push that distance of the coronavirus a little bit further. So important to know when you're doing vigorous exhalation that you might want to add another few feet to that. We've seen up to 13 feet in the singing outbreaks that we saw recently in a couple of papers.
Laura, while you're on that topic, Mike asks another question a little further down that says, why do day camp guidelines say we should limit or discourage singing and yelling, but not resident camp, and is that true?
It is true that if you're going to do singing and yelling, we have to be aware of physical distancing. If it got missed in the residential facility guidelines, it should be consistent between both of those. And thanks, if it is, I'll go back and check, and if it is, we'll make sure it's consistent in both of those guidelines for feedback to the state. But we thought you can think creatively about doing some, you're singing. So if singing is a big part of your camp, maybe you create a circle and everybody sings outward, but just to realize that is a higher risk activity in terms of that infectiousness. I'm Matt, I don't know if you can help me figure out Dana's question.
Day camps, both Maine residents and out of state, coming from many states in a summer community. So it sounds to me like potentially people coming up from Mass or New York or New Jersey to come to their summer home in Maine, who are then sending their kid to Dana's day camp, which also has Maine residents. I'm going to hazard a guess that those out-of-state campers would need to quarantine for 2 weeks before attending camp. I'm seeing Jack nodding.
Yes. Yes, that's the day camp guidance. So that's fairly well spelled out in the day camp guidance.
The main
Um,
residents, no
And the,
quarantine.
and the people coming from out of state, there still is the requirement that they isolate themselves in Maine before they go out into the community, so.
Right. I think that the guidelines have been that if you are from out of state, you must quarantine for 14 days. If you are a Maine state resident, you don't necessarily need to quarantine. But I do think as we said before, this is a luxury for kids to go to camp right now. And so working with your parents to minimize their exposures and their families' exposures before camp would be important. Josh talks about different perspectives, digging in and to find out what local health departments will do if we have COVID at camp. Dr. Shaw refers to an outbreak as 3 cases. This was confirmed by an infectious disease doctor. And what conditions will CDC shut us down? Yeah, so 3 cases is the nerdy definition of an outbreak. So that's what epidemiologists use as their number for if you see 3 cases of anything, we consider it an outbreak. That's why you hear Dr. Shaw say an outbreak is 3 cases. As we said before, Maine has not had a pattern of shutting down shutting down camps based on the number of cases. You know, if you had, during the summer of H1N1, we had up to 20 to 30 cases of H1N1 in some summer camps and sometimes more. And we did not see the state interested in coming in and shutting them down as long as you were following those good mitigation procedures. You can say, these are the procedures that we've been doing, and this is the number of cases we've had, but this is what we're doing. I think the state's more interested in you following a very smart public health plan, communicable disease plan, than shutting you down. Of course, you know, if your camp is starting to get overwhelmed with cases and you can't figure out why, I think it behooves the state to consider working with you to say, what do we need to do in order to shore up cases this summer? Given the short duration of a lot of camps this summer, I think that the likelihood of that is low, and particularly because I know how hard people are working on their communicable disease plan. Obviously concern of shutting it is the unrealistic. Yeah, so that's just, Stephen was just asking another question about the number of people to shut you down. Again, it's not something that that we can put a number around, but it's if you're going to 30%, 40% of your camp with cases, then I would say that you would want the state to come in and help you figure that out. Can we play games with short contact point like capture the flag and flag belts if campers are wearing masks? So for the way that we're thinking about activities. So there are going to be some activities that are higher risk due to their contact intensity and duration, and there are some that are going to be lower risk. There are some activities that are going to be lower risk because if you can do them within your household or within a consistent number of households. So say there were 3 bunks within your your 8-year-old age division. So perhaps you only want to allow games between the 8-year-old age division at the beginning of camp, and that you're going to play that game outdoors, and you're going to use physical distancing as much as you can, and you're going to allow that age division to function as a household itself, that you're going to allow spread between allow closer contact, excuse me, didn't mean to say spread, allow closer contact within that household. So something like capture the flag could happen in that age group. I think it's important to realize that the first couple of weeks of camp, when you're trying to figure out what your infection rates are, or if you do have cases of coronavirus in your camp, you might want to be a little bit more strict about that. You might say, I'm only going to allow kids to play between 2 bunks, or we are going to use face coverings for high contact when physical distancing is not possible for activities. I also encourage camps to think about front loading the first 2 weeks of camp with programming that is less contact intensive. There are lots of different activities we can do with kids that don't have as much contact intensity, and perhaps you want to do those. Perhaps you want to focus on sports instruction from a distance for the first couple of weeks of camp, or perhaps you want to do other activities that require less contact intensity until you understand what's happening in your summer camp. So I realized talking to day camps that that's a different beast, but perhaps day camps want to decide that, you know, certain aspects of camp's programming aren't going to be happening this summer. You know, Parents Weekend not going to be happening this summer for us. You know, you might decide that you're not going to do apple bobbing. I would really not suggest that we bob for apples this summer. So, you know, there might be aspects of the program that are just going to be different. And so I encourage you to kind of go through and risk stratify your program activities and decide which ones are less risk, put those at the beginning. And you might be able to loosen up on your programming after you understand what's happening in your camp setting. So is it required for a camp to be closed, a closed community, once camp quarantine ends for full staffing campers? So the guidelines for the overnight camps is to the degree possible. You really want to decrease that inflow in and out of camp. We definitely saw that with H1N1. We had everything, at least at our camp, we had everything buttoned down until Parents Weekend, and then we saw a resurgence of cases. So the definition of closed, I think, also has to be thoughtfully done. I think if you can keep your staff on campgrounds and find something entertaining for them to do on their days off, I think that's ideal. You may decide as a camp director that you're going to allow people, counselors, to go on their days off on pre-approved trips to remote areas with clear guidance for who's going on those trips. Like the households, the counselors of households go together. So you're decreasing the spread between counselors as the possible contributor of spread within camp. But again, for the first couple of weeks of camp, I just suggest that you tell folks, you know, we're gonna try to be locked down as much as possible. There are essential visitors to camp, deliveries, et cetera, you know, they have to come into camp if they're within physical distance, close physical distance of somebody in camp. I would ask them to be masked. So I think that the bubble, the closed bubble, could be loosened once we know what your camp's health is. But in no way, shape, or form am I going to tell anybody that they should allow their counselors to go to the Liberal Cup and hang out, you know, with 20 other people from a community. That's just not going to happen. I wouldn't recommend that happening this summer. So it's important to tell day or overnight camp families who live in Maine that their relatives can't quarantine with them before sending an out-of-state cousin to join a Maine kiddo at camp. It would need to be isolated quarantine. Yeah, I mean, I think that that's the ideal concept. Is that we're trying to really know the risk of a family before they send their kids to camp. Brittany's question about day camps that are located within a public environment. Our day camp is located within a facility that's open to the public as well. Wow, Brittany, so I think, again, I'd answer that by just saying, like, what can you do to physically distance from the public areas? Can you ask people when they're close to public areas to do face coverings? Can you move your camp to outdoor areas around your facility? Again, it's very hard to give advice, specific advice to the variety of camps that exist. But I would say, use go through all those mitigation factors that you can possibly do, and see if it's it's practicable to employ in your setting, in your physical plant. And as long as you're doing as many as you can, I think that's the ideal situation this summer. Operating a camp that is historically operated at 2-person tents when it's overnight trips. Do I have suggestions on how best to operate campers that would be sharing tents? Are guidelines publicized specifically pertaining to overnight campers and how to arrange sleeping? There is a section on EHE in terms of arrangement of bunks, 6 feet between heads, putting feet at one end, head at the other in terms of bunk beds. I think if you think about the kind of concentric circles of cohorting kids, when they go on overnight trips, you very much want those kids to be going on trips as part of their households and sleeping in tents with children from their bunk, their overnight bunk. So that is how I would suggest that. I mean, when you're going on overnight trips as well, you're using vans, right? So you're going to want to ensure that that a household is the only household in the van, or it's the household that you are willingly allowed to be closely physically distanced to another household. For example, if you had 2 bunks that each had 4 children in them, that's an 8-child, household. So that I think that you could definitely, that number seems like a plausible number. I'm going to stop and just say, I think there's been a lot of questions about numbers, and just going to stop on that for a minute. So a household number is going to be what's best for your camp. It could be 4, it could be 8, it could be 10, it could be 20. I'm happy to know that the main guidelines were not more specific than that, because it's going to be important for us to determine in our camp what our smallest group size is. And then the other number that I've heard about is that sort of maximal group gathering number. Some states have chosen 25, some states have chosen 50, others have chosen 100, and Maine has said that for states that are sheltering or for camps that are sheltering in place, they can consider themselves to be one large family unit. Now, I want to say that the small, consistent groups of campers that do not intermix is going to be one of your most powerful measures to decrease spread in your camp. So make it work for your camp, but do realize that the reason why it's small and that group sizes that larger group sizes will increase spread. So please be really conservative on how you employ that in your camp. So I'm going to open up, if this is a question for anybody in the panel, about the status of IDEX testing for Maine right now. 5,000 available. Will it be impending tourist influx? Their local hospital has contracted with Quest, which has a 10-day turnaround for results, which is too long. Could we as a group build a relationship for faster testing? So I think that's a great idea, to use the purchasing power and the economy of scale of MSC. And I think that's maybe, Matt, maybe a broader question than we want to answer at this point. But if it's your desire to do so, I will leave it up to you.
Thanks, Laurie. Yeah, I think that there's been some discussions around that. So,
okay.
Yeah, you'd say watch your space, maybe.
Okay.
Yeah.
So Dan Gray asks for a 1-session camp that is they will have different, expecting different camp to arrive at week 3. Do they need to quarantine in Maine away from camp for 2 weeks? So you'll have staff, you'll have a 1-week camp session. Halfway through, you're going to have different staff coming in. If they're from out of Maine, they should quarantine. They don't necessarily need to quarantine in Maine. They can quarantine at home if they're coming directly to Maine. I don't think that they need to quarantine. I would just suggest that they do a good quarantine before they show up at your camp. And if that's not possible, like say they're Maine individuals who don't have to quarantine, then you're going to use those other mitigation measures when they do come into camp, that for a good period of time, they're going to face masks when they're close to campers. They're going to try to stay physically distanced as much as possible.
Laura, I think Bobby Strauss had a question as well, but panelists can't ask them in the Q&A apparently. So we learn something every day. Bobby, go ahead.
Indeed, I think we have a couple questions. Thanks. One would be within a cohort group early on within the first 2 weeks using like equipment, basketballs, tennis balls, if that you think would be acceptable. And the second question would be if you do offer trips out of camp to remote areas, if you have a specific cohort group taking it one day and another age group or of a cohort group the next, would that be acceptable? Thanks.
Sure. I'm going to ask a follow-up clarification about your second question. The EHE guidelines have some great, very strong guidelines about cleaning aquatics equipment. And I think the Red Cross just put up another guidance document yesterday, which can be found at the EHE Field Operations Guide section on aquatics. There are also, lots of guidelines about how to clean various surfaces. In terms of shared equipment, it's just not going to be possible to clean everything 100% of the time when you think about a camp environment. So let's step back and think about what's the risk. The risk is not that there is somebody who had touched a baseball bat, an hour before. The risk is that that person had coronavirus, touched the bat, the next person's going to touch the bat, and that person's going to touch their eyes, their nose, their mouth. So, I highly encourage camps this season to think of washing in and washing out of activities. So we're going to sanitize before we play baseball. We are going to sanitize after we play baseball. And in the meantime, we are going to talk about not touching our face. And we don't want to chastise kids loudly from far away. Get your hands away from your face, like I do to my children. But we want to just, carefully remind children, after we wash our hands, remember, we don't touch our face. And they're going to need reminder. So I think much more I would focus on hand washing than facilities decontamination. Your second question, I think, was about overnight camps. And can you just rephrase that for me? About if one cohort goes out one time and then one follows?
Right. It would have to do with the actual vehicle is my question as to, obviously we'll do our best to try and clean all surfaces, but do we think that's going to be enough? And also just to back up a step, on the hand washing, we're planning on dipping all equipment after the use, after a period, basketballs into a Clorox mixture, and was wondering if that might also work for their hands, if they could, because obviously not all of our activity areas would have hand washing facilities that would be adequate. Do you see that as a possible solution, that everybody, in addition to dipping the equipment, whether it's a life preserver or basketball, also dip their hands on their way out?
So in terms of the vehicle between individuals, I think it's great to wipe down high touch surfaces in vehicles. But again, washing your hands before you get in the vehicle, washing your hands when you get out of the vehicle, I think is more important. Remember, coronavirus continues to be a respiratorily spread disease. The vast majority of spread is respiratory. I would say that I would recommend you checking out the EHE website for appropriate hand sanitizing solutions. I'm not sure that bleach is on that list, but certainly you can have hand sanitizing stations. The hand sanitizer can be out, everywhere. You don't need to physically wash your hands with soap. Hand sanitizer is fine. And maybe every camper has a mini hand sanitizer clipped to their water bottle this summer. So when they take a drink, they can wash their hands. So if you need to test a camper this summer, the main Department of Health, it has increased capacity, but also you'll want to develop relationships with local facilities as well, so that you can get that testing done as quickly as possible. Bob asked if you run a 1-month camp, could you relax some of the interfacing between small groups after 14 days if you've been all clear? So I think that that's a very reasonable approach, is that once you have a handle on your camp and you're doing all of these mitigation measures, you know that your counselors are not sick because they've quarantined, you know your campers have been well for the first 14 days. I do think that you could consider relaxing some, but not all of the mitigation measures. Maybe you allow larger groups to come together for short periods of time, but you just want to make sure that you don't relax every mitigation measure, that you continue to keep some of the more important ones in place in terms of hand washing and good face hygiene, good cough etiquette, good sneezing etiquette. Of course, the price of liberty is eternal vigilance, right? So I think there's a big argument of who said that. I read yesterday that it's not Thomas Jefferson. So you can get some other data today besides camp data. But in any case, I like the saying, and I think that it is important that we remain vigilant. It would be really, it's really important to realize that we're sending these kids back home. And we really want kids, parents on the receiving end to receive healthy kids. I think all of us have had parents call us after they get home and say, Tommy had this and he contracted it while at camp, and that makes us just it doesn't make us feel great about our camp programs. So yes, I think we can relax some things, but I think it's important to continue to be very vigilant. Oh, yes. Thank you, Bob. It was Wendell Phillips. That's what I found as well. Although I saw that there was an earlier Irish lawyer that also said the price of liberty is eternal vigilance as well. So I could go back even further, but I do think that Wendell Phillips is the person who I would acknowledge for that quote as well. But now we've all seen Hamilton, so we know what Thomas Jefferson was like, right? Matt, how should we continue?
I think you did outstanding. Like right at 10 past 12 is where you cleaned up and answered all those questions. It was outstanding.
I'd like to add one thing, and that is that Dr. Laura and I have had a conversation about her doing a webinar for health center staff sometime in the near future. And so we will get word out to you when this will happen.
Great. Good luck to everybody as we begin this whirlwind of a season in your decision making, and know that we're all together in solidarity.
Thank you so much.
All right.
Thanks, Laura. A big round of applause to Dr. Laura for that amazing and rapid fire answering of all those questions. So next up, this meeting is just going to keep rolling. Next up is the focus on resident camps for the next half hour, and then at 12:40 the focus on day camps. So feel free to either stay on the call or to come back at 12:40 if you're more interested in day camps and resident camps. And at this point, I'm going to turn facilitation over to Bobby, Terry, Laura, and Steve. I see Fritz here as well, and I know we have Ron and Jack also available to answer questions. So good luck to all. I'm off to get a cup of tea. Can't leave you lot alone for 5 minutes, can I? So I think the goal was to for this group again to have questions sort of asked, and Pam Cobb is kicked the ball. She has kicked us off with a great question there, with the latest and best practice ideas for bus, air, auto transport for staff and campers. So who wants to take first swing at answering what we're thinking about for latest and best practice ideas for essentially travel to and from camp?
I can just start with a little bit of information that the main guidance that came out, we were successful in getting our travel from camp to home back to, travel to camp from home and back to home auto drop off into the plan, which permits somebody from out of state to drive in, kind of not necessarily ignore the governor's order for 14-day entry, but promise to leave the moment you drop off and depart again. That was part of the piece that helped us a little bit with going forward in the guidance. Pam, I'll also, I don't have much personally to comment on airline. I haven't been thinking or focusing on it personally, but I do know that I could recommend that if you're considering bus transport, that you check in with who your bus vendor is. I had a very nice conversation with my bus vendor the other day, who provided me with the details on what their cleaning and disinfection plan was, what their driver plan was, what their capacity sizes were for a 56 passenger bus, their expectations for being able to support and provide service to you. And so if you have not checked in, you probably should, and just see where they are.
I'll just add to that. There's nothing official in the guidelines that prohibits bus or airline travel. So it's, again, as we've been talking about this morning, going to be up to each camp to make sure those layers of safety are part of any form in which campers or staff come to camp. We're planning on having counselors arrive by public buses, not chartered buses, and also by a flight. And so we need to have in place the same pre-screening and pre-quarantine screening when they arrive, and then quarantine when they arrive. Not isolation, but quarantine when they arrive, and daily screening while they're here. Again, just layering as many safety mechanisms as we can, regardless of how they arrive at camp. Did we lose we totally lost our moderator. Okay, I'm taking over as moderator. Here we go. Well, that's the abolitionist, Wendell Phillips. Thank you, Bob, for that. That is excellent history right there. Anonymous. I would love to hear what camps are honestly considering for their household sizes. Okay, great. Thank you. Bobby Strauss, you want to take a shot at that one? You share what you're doing for sizes? Can you get unmuted?
Trying that, yes.
There we go. Okay.
Now. Thank you.
There we go.
I actually have one of my program directors at a good social distance here, Neil Goldberg, something that we've been suggesting and talking about today and in past days, and I think he has a good answer for that.
So obviously we're gonna keep our bunks as the smallest concentric circle at around 4 to 8 kids. And then we will allow some programming early on in groups of about 30, but those are gonna be socially distanced activities. Those are gonna be outdoor crafts, athletics that don't really involve much contact. And that's gonna go on for about 2 weeks, at which point we'll open up to a larger concentric circle. I don't know if I hope that helps.
That's great help. Thank you so much. Anyone else that's immediately on this call? I'll share what Winona's thinking. We're going to limit our overall camp size to about 200. We would usually be running the same program time, about 325, so we're limiting our entire camp to 200. We are further breaking down into age cohorts of about 65 campers and staff each. We'll have 3 of those age cohorts. Within those age cohorts, we will further be divided into what we call tent pods. We have tents here at Winona, and those tent pods will be made up of approximately 3 or 4 tents, which the pod group is going to be what we consider a household. So those households will be numbers between 15 and 18, who, as Dr. Blaisdell mentioned earlier, those will be the groups that are sharing lodging, sharing dining tables in the dining hall, who attend activities together, who can go on a trip together, especially during those first couple weeks. And then within those first 2 weeks of quarantine, the age group cohort size of about 65 campers and staff will partake in group activities, but with social distancing or other measures employed. And it will be rare for us to have the whole camp together as a group of 200, but when we do, it will be only in outdoor spaces with a lot of physical distancing. Anyone else? Steve, you want to add in on that?
I'll just piggyback on the Winagonic model. Sounds extremely close and similar to the Winona model. Approximately a total population of 200 rather than a normal 300. Household groups of more than one cabin in this scenario with what Winagonic is, but in very small, multiple sets of cabins. And then we, in our traditional unit campus setting anyway, consider those household groups in a unit or in a neighborhood. We've heard that term a little bit. That then is that next layer and next circle. And very unlikely that the neighborhoods would be intermixing through the summer. Very similar.
Yep. Great. How about, we have a question here from Stephen. If you have campers arriving at Logan Airport, counselors are going to pick them up like usual. Other than having those counselors wear PPE, is anyone else doing anything to keep those counselors safe since they are leaving the bubble after a 14-day quarantine? Okay, Stephen, great question. Anyone want to take a shot at that? Who do we have here?
Yeah.
I think it's Bobby or Steve. I keep throwing out to the same.
It's a great question, Mr. Bernstein. It really is. Without knowing that I have a prearranged answer for this, I think that it's going to be pretty apparent that you make sure that those staff that have departed your property to collect children and come back are in some type of self-assessment of themselves while they're out, and they're documenting that, and they're bringing that information back to your health team when they come back. Just like they're going to be doing assessment of the children they're collecting, and again, providing that documentation to the health team on arrival. That's my first reaction to that.
Yeah, and just a reminder, all staff are going to reset their clock regardless, because you're now having the staff, the whole point of the staff quarantine is to identify anyone who might be ill. It's not to give them the clear for the summer, because then of course your campers arrive after 14 days and the staff clock of quarantine starts again now with their campers. So to have a staff member who's quarantined for 14 days and is safe and in the clear and then goes to Logan or the Portland Jetport or wherever it might be out of your camp bubble is absolutely okay, taking precautions. I'm not going to send mine in full PPE. They're going to have general guidelines of being safe, probably a face covering, but not full face shield and actual protective wear over their clothing. And they will collect campers. They will run screenings before getting in the vans or on the buses, and then back at camp we'll screen again and everyone will begin their quarantine at that time. Heidi asks, are the pods being decided upon due to where the camper lives, differentiating high-risk areas of origin and low-risk areas? Great question. Bobby, are you? Are you changing, are you creating your households or your cohort sizes based on where people are coming from or age groups? What's your defining characteristic?
We've actually been discussing that as to what the best strategy is going to be. And one of the ideas that we have is to keep boys that have flown to camp in a cohort group or a community or a family group, at least for the first couple days until you can assess and possibly screen and test. And that may be your best strategy, because if you get an issue among that group, that's truly the group that's been out in public as opposed to the group that's been driven to camp. So I think we're probably going to go in that direction early on.
Great. How about Fritz? Can you jump in with what Fernwood's going to be doing with that? How are you creating your households and your co-groups?
We're doing a couple different things. Obviously, the bunk is the smallest group, and we'll do groups of 10 to 12. 10's our ideal number. So we'll try to do that. I do have one bunk that has 40 kids in it, 40 people, not kids. And we'll divide that up into 4 different little sections. I think, Bob, like for me, it's gonna be trying to figure out, okay, week 1, do you sit on each other's beds? Probably not. Week 3, without any cases, do we relax that? Probably a little, not a lot. We're relying on masks a lot and social distancing. We anticipate being outside a lot. We'll do all of our activities not in the bunk of 10. We'll probably do those in our cohort will be an age group, and we have between 26 and 30 kids. Typically we have 30 to 38. We anticipate being in or hope to be in the under 30 range for that. So, and that's our plan. We have a meeting on Saturday with admin, and after that have a meeting with staff, and I'm getting millions of questions, and a lot of those things are like, yep, we thought of that, and some are like, yeah, I didn't really think about that yet. And so it's I think that it's in some ways overwhelming to try and figure it out. In other ways, it's exhilarating to try and figure it out, right? Like, how do you go to the absolute most minute part of the day, and what does it look like? And but for me, I took something that Dr. Laura said really to heart in the beginning, and that's kind of been going for us. One is that you're going to be cohorted within the family, and your bunk group is going to be like your family at home, and probably just not for the first couple of days till we can make sure and assess where we are. And that is when I'm at home, I'm not wearing a mask. I'm sitting watching TV, reading a book with my daughter, wife in the living room. It's a family. And then past that, I'm going to be really careful and try and socially distance in that bigger group. And then anytime you have to get out of the bigger group, which I'm going to assume it's going to be multiple times in a day, you're going to have to mask. Socially distance when you can. Masking's better. I go back to watching, as we all have, the governor of Maine's conferences, and I find it a little bit comical when they try to take their mask on, put it back on, take it off, put it back on. And that's what it looks like. And that there are going to be a lot of masks on and off, and that's the ideal. And we're not going to have mask police going around and saying, oh, you're not wearing one. Okay. I mean, I think it's going to happen. My final thought is that our camp doctor had a webinar for our parents the other night, and we threw him a softball question, and he said, the question was, are kids going to be allowed to hug this summer? And he said, I'm really worried about kids that want to share an ice cream spoon or kids that want to drink out of the same water bottle. I'm not as concerned about 2 masked kids that want to hug. So we are going to have hugging as a thoughtful event.
Thank you, Fritz. That's great. I do want to just add something Fritz made me think of. Although I know what you were saying when you said there's not going to be safety police, I do want to encourage all camps who are moving forward to do what we naturally do, which is make difficult tasks fun and entertaining. So I'm sure that Winona at different times will have a camper designated with a whistle and a mask and a cape and something else that's cool and fun to stop a dodgeball game and get a ball back from one cohorted group to the next cohorted group, wipe it down and hand it off and start the game again. And then more kids are going to want to be safety officer the next time. So there's lots of ways that we can incorporate fun, camp fun, into the seriousness of safety. So I think that's a good topic for us to remember. Pam always writes really short questions, which I think will be easy, and then they're not. So, Steve Sudduth, what do you do with a camper or staff with a high temp at Logan? Take it away.
Yeah, so Laura, Pam, I assume that your question is geared to the camper that gets off of an airplane on their own and you're collecting as a staff member. If it's a camper that's being handed to you from a parent, you have an out right there with that temperature check, perhaps. But if it's a camper that's on a flight on their own, you are in a bind. And I agree with you. And I don't have a really excellent answer at the moment, other than the times that this has occurred in the past. Granted, this is a much different situation, but the times this has occurred in the past, there was assessment and checking, and there was the, in fact, partial isolation of a child on a bus with others. That doesn't sound like a great answer to the question today, other than knowing that the capacity sizes of the buses for 56 passengers will not be 56. And again, check in with your bus guy, and ask him how many people are going to be on that particular bus. Perhaps there is enough distance for you to bring that child into camp, get them to the diagnostic test, isolate them while the test results are being converted, et cetera, et cetera.
Yeah, and I would just add to that by suggesting that you might have a runner vehicle for your airport trips. If you're having a bus from Logan or a bus from Portland, you probably want to have a smaller staff vehicle that people can be safe within that staff vehicle, and you can get a child who's unaccompanied back to camp. Remember what Dr. Blaisdell said, the vast majority of kids with fevers this summer are not going to be COVID positive. You're going to need time to figure out what it is that they do have and make sure that they're isolated while you're figuring that out. But I do believe that our responsibility, if a child comes off a flight unaccompanied, that we need to have plans to get them to camp, into our isolation, into our shadow camp. There are other considerations. People have mentioned that friends of camp might have a home nearby camp, so that that child could go there for a short period of time. But again, that depends on your particular camp situation and who are the residents of that house at the time, and if that's a safe possibility, so that you can maintain the status of that camper who we didn't know and presumed to be positive until proven otherwise did not come onto camp property. I understand that that's an important statement also, if that's doable for you. Bobby, did you have something to add to that?
No, I was just going to say, we were going to suggest that same thing, to have the shadow vehicle, have that second vehicle, no question, for any of these trips, just in case you get that. It's a great call, no question.
Yeah, Winona for years has been having an isolation hotel room designated on all our trips to the airport, so that there is one there. And that's another option, is for you to be able to keep two staff and a child who's not feeling well at the airport until you figure something out. But I guess in our case, we're planning to bring kids to camp and isolate there. Anonymous asks, would staff quarantine time have to reset if, for example, instructors for lifeguarding or other training came in to train? The answer is no. You're going to have to make sure that any instructors follow very strict social distancing and other safety procedures, such as they need to be screened when they arrive at camp. They need to be screened daily. They're probably going to have to teach from a distance, maybe incorporate more online test training or opportunities, teaching opportunities while there. They're going to have to probably wear a mask and or face shield. And then similar, you want to think of them similar to your office staff member who lives locally, who is coming in to camp every day. And you have to keep that office or whatever staff member you may have who is coming into camp. Even though we have been okayed by the state to be an isolated bubble, we still have the ability to bring people in on minimal levels for essential business safely. And so a teacher, an instructor coming in to do a staff training would not reset the quarantine clock, but you would have to make sure you were abiding by those guidelines. Anyone have stuff to add to that? That's a great question. Okay, and Pam adds, maybe request parents give us an update temp as they check in at the departure airport. Absolutely, that's great for screening kids. All right, and that's, are there other ones in the, if you had a question higher up in the Q&A or in the chat and it has not been answered, if you could repost it, that would be helpful as we move along here. And oh, there's Matt. I'm trying to be cognizant of our time. We're going to have just while we're in the last few moments here, and we'll take one last question. Heidi, are the people designated to care for sick campers completely separated into their own pod, not interacting or sleeping with healthy campers and staff and others that are in contact with the healthy pods? Another great question. Winona's come up with a little bit of a plan about that. How about, but let's hear from someone else. How about Terry or Fritz or anyone else who's planning to have folks on site this summer? Do you have an answer of how you're going to staff the isolation area?
We are still working on that. I'm actually working on that with our healthcare staff because we're just not completely sure right now.
It's a good one.
We looked at it and said our infirmary is really busy and we want our infirmary to stay busy. So we'll have an intake tent outside of the infirmary. And if you have a splinter or a common ailment, need a Band-Aid, you're going to go left into the infirmary. If you have a COVID-like symptom, you're going to go right and to see the COVID doctor into the COVID area. And we'll have a room in there that's a well COVID room and a questionable COVID room and here's the isolation room. So we've really tried to break it down that way. And we had a counselor early on who said, what do we do with a kid in the middle of the night who's coughing? And we said, okay, we're going to go there. And instead of going in the infirmary, you're not going to the infirmary. We're going to put that child into the suspected room and we're not sure room. And our doctor luckily said, well, just wake me up. But in case he doesn't, they'll go in that suspected room so we don't have a child coughing all night in a bunk.
Fritz, remind me to come and see how large your health center is. That sounds impressive.
4 rooms.
So for the rest of us, that is awesome. So Heidi, we have a smaller health center here at Winona, and what we're planning to do is we're similar to what Fritz says, but on a different size. The health center I'm trying to keep as absolutely safe for our health center workers to work in without PPE. So they can answer questions, they can reply to emails, they can be in there. And what we're doing is the tent outside is actually the triage area. And if, even before you get to the tent, if you're here for a splinter or a cut or your medications, you're going into the health center, which has been deemed COVID-free. No one with signs and symptoms are going into there, because it's also, for us, it happens to be lodging for our nurses and a workspace for them. Meanwhile, the tent is going to be the triage of anyone who has a persistent cough or fever. And if those things are not cleared by the triage nurse, they're going to be transported gently and with care to another part of camp, which is our isolation area, which, again, this is what we're planning, but we don't have it cast in concrete. We would like to be staffed by different people. And if those people are hired to be our COVID folks and be the caregivers for our isolation camp, and they are sitting on the dock and getting a tan all summer instead of working, I am perfectly fine with that that expenditure. That's fine with me. But we are trying to move forward with our with 2 separate health center staffs.
Philosophically exactly the same, and even I'm glad that you said staffing it. So we have 4 live-in RNs, and then we'll have 3 people that are just gonna be COVID, and I hope that they're just delivering water and telling kids to put suntan lotion all summer. They're not RNs. I have 1 CNA, 1 LPN, and 1 EMT, and all of them have been working in COVID situations in the winter, so they don't feel uneasy about it. I would say that 2 of my 4 nurses were really relieved that they're not going to be COVID nurses. So it's
another great question.
I'll just
Steve?
finish
Yeah.
that up by saying that as you heard, these different sizes of, like, Fritz's massive sized health center versus Laura's tiny health center, there's going to be a lot of different mixing of how to figure this out, right? Where you might want to consider starting is when you are creating your isolation plan, try to identify how much intersection or non-intersection that isolation plan and location will have with your healthy health center. And from my recommendation to myself for how we're trying to handle that is that although there may be some confliction today on how the intersection is staffed, the physical locations will be separate on my property. My isolation plan does not include my health center for physical location.
All right, great. Thank you, everyone, for answering these questions. I know there's more there that we didn't get to. I think anyone on this panel that you see in front of you would be more than willing to take an email or a phone call if there's something pressing that you would like to have answered, or just, share some ideas. That's the purpose of these, and we hope to do more of them. Matt, can you tell us how our timing is and if we're ready to move over to day camp focus?
Yeah, your timing is spot on. And I threw in the chat a little while ago for any day camps that we still have on the call, on the webinar, to start throwing questions into the Q&A. Tom, do you want to kick it off by just sort of talking about some of the stuff that's more pertinent for day camps? I think one of the big questions that a lot of people have had is regarding drop off and pickup, right?
Yep, that's a big one. We're going to do 7 different drop-off and pickup locations, and we'll be routing them through parts of camp and dropping them there. Some of the advice that we've gotten from Redwoods did a good training on utilizing folks who have been offering emergency childcare for essential workers and how they've been doing and some of the issues they've run across. So we're a beneficiary of listening to that training. Some of the things they're offering are that as parents stay in the car, parents don't get out. eliminate the parents touching pens and signing the kids in and that kind of stuff. Have the staff work through the passenger side, so you've got a little bit more distance between the parent and you because you've got constant contact. We're also have invested, I don't know how reliable they are, in about in one infrared no-touch thermometer for each pickup location, or drop-off and pickup location. We're also debating, some of the advice we're getting is to have the parents record the child's temperature for 14 days prior to coming to camp. I'm not sure how much compliance we'll get on that, but there is a pre-camp checklist that's put out by the Association of Camp Nurses, which seemed really good. So that's before the child arrives at camp. The parents filling that stuff out just to try and raise awareness, I think. And then we'll ask a similar set of questions. A staff member will be there, ask those questions, take the child's temp, and then immediately they can move to washing their hands or using hand sanitizer and then joining their group. And once they do that, they'll have a designated space for their backpack and that kind of stuff marked out. And then there'll be also, you know, their scissors and their crayons and markers and all that kind of stuff will be theirs over the course of the summer. So trying to cellularize operations as much as possible as we move into the camp day. And then keeping them in groups of 10, all during the camp day. So that's kind of, I think, where people's, and then I think so we're trying to keep our staff to 40 hours. So we're going to reduce our early care will be starting at 8 o'clock. Camp day starts at, we're a 9 to 4 camp day. So our parents need early and late care because it's functioning like childcare for them to work. So they'll start at 8. A single staff person will cluster so that they're visible to another staff person. The first drop-offs start to happen. And then once they get a couple of kids there, then they'll be able to move into some activities. And then as the day winds down, 4 o'clock, kids start to get dismissed at that point. And then once they're down to two kids or so, they'll start to group up in smaller areas so that they can get checked out, and the staff is still, they're not alone with a child. So.
What are you going to do if a child during the course of the day is not feeling well?
So we have a similar plan to what you folks just talked about. We'll have, if the weather's not too bad, we'll have our director out under a pop-up, and we'll also have our nurse out under a pop-up tent. They'll come to the nurse, and then we have an isolation room, which is completely separate from our health office. It'll just be a bare room, basically, with a few pieces in it, a chair, maybe a small bed or something like that, something that's easily sanitized after the child was in there. And then, of course, being at day camp, we'll dismiss the child to the parent and give them some options for where there's testing in the area. If we think this is our first year in quite a while running with a real RN nurse. Normally, as I think you're aware that day camps can run with advanced first aid or wilderness first responders and that kind of thing. And so we'll have one of those during the week for one day, but then the other days we'll have a real honest to goodness RN there. So, and of course we're 10 miles to Portland, so it's a fairly easy thing for us. We're not a remote day camp. So.
What are the policies going to be in order for a child to return?
There's a CDC checklist, and I think probably conferring with that child's healthcare provider and just getting a note, and also making sure that we're following that CDC checklist. So what we're doing too, and I think a lot of people are probably doing this, we've written down our sort of COVID policies, and we're running by a couple of doctors that are associated with camp, our camp doctor, and then a parent who's actually an infectious disease physician whose daughter will be with us all summer. So she has a little skin in the game at that.
Yes.
So, which is pretty handy. We do serve a high percentage of folks who work at Maine Med in a variety of roles, obviously, but a lot of physicians. And that's been one of the things that sort of pushed us towards opening, is because, the people in the know are saying, hey, please open. I think developmentally, one physician actually said, developmentally, it's more important than the virus pathology is more important for us. So we made that hard decision to move forward as carefully as we possibly can. Obviously, we don't want to make anyone sick.
For those of you just coming back on, we are in the day camp portion of the main summer camp meeting, and Tom is doing a good job answering our fire rapid questions. But if you listed a question earlier in the Q&A or even in the chat, if you could repost it in the Q&A, that would be super helpful for us, and we'll be able to see it more clearly rather than scrolling back up. As we wait for a couple more questions to come in, Tom, I think it's just helpful for people to hear how Catch is going about this. Can you tell us a little bit just what you guys have been doing for the last 2 months, and then how that's going to change as you get into officially phase 2 on June 1st?
So we've been actually right now we're putting up a yurt on the property, which will provide some storm shelter. So we think that the limiting factor for our capacity, so we were at 330, I think, per week, and we need to come down a lot from that. So the June timeframe puts us, we believe, reading that at 56 campers. So that's a significant drop. And the way we got to that was by looking at how many self-contained stormable spaces, places you would be comfortable putting your children in lightning storms, and figuring out the square footage. We're also licensed as a childcare facility, and I know Jack doesn't like to commingle those things, but not knowing how big to how much space to allocate in a building, which we would normally put 20 or 30 kids into on a nice day or on a rainy day, we use the childcare spacing of 35 square foot per child. And that gave us kind of something, at least we can point to in defensibility, saying it was, this was a number they gave us, we just went with it. So we transferred that over, and that gave us capacities for our buildings. We're not going to exceed groups of 10 in June, but after June, we could subdivide those spaces probably and be a little bit more creative if we felt like we had a handle on the situation. So that gives us our group sizes and our capacities, and the ability to drop off independently, so there's no cross connecting of parents or cross connecting of kids and those kind of things. So
Sarah asks, are there any programs you are not offering this summer, such as athletics?
Yeah, and if that's Sarah Seward, we're also not offering horseback riding, a big part of her program. We just, for a couple of reasons. One, we have to rent the horses and the risk of that, so we're not going to offer horseback riding. Because the other thing, in concert with our vet, to be able to, because obviously you have a child on the back of a horse that's breathing hard right into the mane and into the head part of the horse, and how do we clean that, because children will grab that. And so just the whole idea of trying to clean a horse after each ride was a little bit daunting and probably not so good for the horse's skin. And then the other thing is the economics of the horseback riding. So we won't be offering that this summer. The other programs, we typically offer part-time programs. And because we're trying to keep our groups connected, consistent, those would represent kids coming and going inside those small households, and we don't want to have those. So we've eliminated the part-time program. We also were piloting and have always sort of served 3-year-olds, 3 and 4-year-olds. So we've done away with a 3 and 4-year-old program because of it's a new program. It was a new program for us. It's sort of a carryover of our existing nature-based preschool. And so we put that program on hold for this year. We'll be serving 4 and 5-year-olds in our traditional camp population, and going up from there. So the programs that are not happening are, and we're also debating on whether we can get to high ropes, and looking at what the procedures were with that, but we've delayed that decision until later in the summer to see what the protocols are coming out from ACCT and other places like that. But to get open on either the first or second week of June, we probably would not be offering that. Just low ropes, team building things that are distanced. We also stopped offering our busing to and from camp because of the complexity of that. The other issue is just a cost issue with 50 kids. you know, a busing at $200-300 a day just didn't make sense, and we couldn't make that fly. So hope
Great.
that's
And
answering Sarah's
just
question.
before we, no, that's great. Just before we move on, there's several other questions here. I do want to mention to everyone that there is a section in the ACA field guide about horseback riding. So while a particular camp may choose not to do horseback riding, there are guidelines of how to incorporate that in your program if that's what you would like to do. It is not by any means a banned activity for the summer. Tom made the right decision for his location. Also, we heard at the previous part of the meeting that the ACCT is not going to allow for certified high ropes and towers to be open, but that's just if you're certified through them. And I think you can get, for example, Winona is not certified through them. We're certified through another organization. And there seems to be lots of resources out there of how to properly clean high ropes and an outdoor climbing tower to meet the expectations of the ACA field guide. So those, again, they might not work for your program, but there do seem to be pathways forward with other locations. We're wrapping, let's see, let me make sure we're back to the map.
We were clear with our parents on the horseback riding that for us it was an economic decision. It was slightly a vet decision, but it was largely an economic decision driven by our program. So.
Yeah, Winona made the same one. We are at, Dana asks, along with parents documenting a child's temperature for 2 weeks prior to attending, if they are from out of state, are you requiring the parents to document a 2-week quarantine as well?
We don't think that's going to be an issue for us. We serve so few out of state parents. We hadn't, most of our parents are, I think we're going to have to get so small and so concentrated that I think we would if we knew they were from out of state. All the parents that we know of right now are local working parents that are in the Portland area currently. Most of our out-of-state parents have already withdrawn, so we haven't had to face that decision. But I think, yeah, I think you need to make sure that they were in the state for 14 days quarantine before they came to this. We're down to serving. When we met with our board of directors, they favored serving kids that were with us all summer and also kids that are whose parents are providing essential work. And so we surveyed parents. Is it just one parent? Is it both parents? Because we're going to have to make some hard decisions as we come out of the voluntary withdrawal part of our registration rollback into when we actually have to, unfortunately, probably dismiss kids from camp who really want to be there, which is a painful process.
Yeah.
Sarah Stewart, did you have? You can talk, Sarah. I gave you that capacity. Did you have a thought about how to maybe do some verification for those out-of-state day campers?
It's a great question, Matt. I think you can hear me.
Yep.
We have, even though we've been a residential camp all along, we have a very small amount of children that come as a day camp, which has been a nice stepping stone. And so we do have some families that are not Maine residents, but do own in the state of Maine and summer the entirety. The only thing that I've thought that I could do is 14 days prior to the start of a program, should we host a program for day campers, is that I would video conference with them at their home in Maine so that I'm able to see where they are. And, you know, we're talking just such a small amount of people. I feel as though we do have some really lovely returners that I feel confident that we could do that, but just do it on an individual basis. And we would have to have some good faith that they would start to take temperatures as well.
Yeah, that's great. That's Sarah, thank you. That's Maine Summer Camp Innovation right there, right? Not outlined in any documentation I have seen yet. And yet there you have it, like Zoom with them 14 days prior in their main location to not only for peace of mind, but for legal purposes, demonstrate that they are truly quarantining in the state of Maine at that time. I do think that there is a path forward also for day campers from out of state proving that there is a quarantine prior. Resident camps have the ability to do that. And so that's going to take a little clarification. But again, I do think that day camps right on the border with New Hampshire, we're gonna have to clarify that and figure out how that can work for that crossover. How are we doing, Matt?
Question about bathroom sanitation.
Oh yeah, bathroom.
And I'll jump into that. So each of the groups, each of those 10 groups will have their own bathroom, which will be a porta potty. In some cases, a latrine, a bathroom in the main building, and we'll clean those down every day, basically. And if a group has to share one, so for instance, the one at the pool, would be a shared restroom, so that would have to be cleaned between each of the households coming and going, to borrow Dr. Blaisdell's phraseology. And we're also running, Tuesday, we're going to run some more water lines around camp so that each one of the locations has a full-on hand washing station at their location. So
that's great. Thank you. Yeah, we're doing spigot designation. Yeah. You know, everyone gets a spigot.
I skipped over one, off-campus trips, Laura. So Ketcha, and again, we're not by any means experts. We're figuring this out with everyone else. We've decided no off-campus trips for right now, and we haven't canceled everything into July and August, but we're probably going to play it pretty close to the vest. The only exception to that might be a mountain bike trip that we would typically do to like a wilderness as Cape Elizabeth or those kind of places can be, but places where they would likely not enter. So no Aquaboggan, no, no, those places are closed anyway, but none of those sort of large gathering public beach kind of trips. We'll be staying pretty close to home here at camp. So.
Okay, thank you for answering that. And I think we've done all the other questions, and Brittany, I think she was able to jump in just a little bit late, so she missed hearing about your drop-off procedures. Sure. Do you think you could review that?
Yeah, I can run through those quickly. So if we have 7 groups of 10, for right now, we'll have 7 separate drop-off locations, hopefully in a circle kind of situation. Staff approaches the car from the passenger side, asks the screening questions, scans the child with an infrared thermometer. Everything go, then the child gets out, backpack, washes their hands, places their stuff in their designated location, and joins their group. Sort of the end of the day, the same kind of thing. We're trying to keep parents from coming in and out. That can be a real problem area. Parents getting out of the car, they bring the puppy with them, everyone piles, comes, and I think you can see how that goes. And so unfortunately, that's a real fun part of the day for everyone, but it's something we won't be doing the big opening and closing circles with 300 kids and 100 staff on the field and that type of thing. So like many people, we'll throttle back on that and make it more of a small group experience this summer. So.
That's great. And can you let us know how you're doing food? Sarah asks, are campers going to bring their own lunch and snacks?
And that's been always us. That's been always what we've done. We've done pizza lunch before, and that's been staff sort of serve out pizza to the children, individual plates. Everything's disposable, goes in the trash. They come down through and just grab what is a set lunch, and then they toss that. And I think, looked at the guidelines, I think we can pull that off. There's no cleaning, we wash tables and stuff like that, but there's none of that kind of more elaborate. There's a local pizza place that drops off 100 pizzas or so for us. So.
Awesome. I'm coming on that day.
Wednesday.
Okay, Wednesday, I'll be the person outside your bubble waving for pizza. All right, Tom, we've really put you on the spot here and you've done some great stuff. Let's finish up with our last question here. Sarah says, I saw a great suggestion of QR code for check-in. Sarah, you want to mention that while you're here?
Yeah, sure. I was in one of the ACA forums, and someone had thrown out the possibility of someone designing a QR code for the parent with their cell phone so they can just go ahead and bump that in, and that's a great check-in, kind of hands-free.
Can you, for those of us less technically advanced, can you explain what a QR code is?
Ooh, I would probably ask someone else that's more savvy to do that.
Okay.
Hang on, I'll get you a picture of a
Think of
QR
it in
code.
terms of your boarding pass on an airline.
Right.
Thank you, Laura, because I didn't know either. I had an idea that I knew, but
Yeah.
Oh, there we go.
Matt, are we supposed to read that or like how? You know, come on.
Just use your cell phone.
You
Fritz,
scan it, right? Yeah.
Anyone who's under the age of 20 can read QR codes. Just
So I think the key part there is those questions get asked, and then maybe that logs it in somehow. I'm not sure, but you know, and tied to that child, so we can document that we did ask those questions over the period of time. We're trying to figure out whether we actually need to have the parents sign or initial in. We've never had parents sign children in or sign them out. We've always had staff do that. So I think that's something we can keep going. So.
If I can just jump in one quick session, Laura, we put in cameras last year. And so that's another suggestion, is just by logging that the child was dropped off or picked up with the camera, that may suffice as pick up and drop off. And then there's no interaction.
Yeah, excellent. That's a great suggestion. Again, that I haven't seen in the guidelines. So that's for the camps who have it, make sure you implement those, and camps who don't have it might want to consider, although I realize all of us are struggling with our expenses this year and keeping them as low as possible. So maybe it's a counselor with a cell phone, videoing drop-offs and pickups. Okay. No, Jack, you can't answer that. Okay. You can't comment. It's perfectly legal. Matt, anything else, Ron, to wrap us up here as we close out a very productive but long morning?
For me, just a reminder that next Tuesday we have a 10:30 meeting for camps that have decided to close. And next Wednesday, we have the Bob Ditter workshop. And I want to thank everybody, particularly our panelists, for doing this today. It's been fantastic.
Yeah, well done.
Thank you, Matt, again, and special thanks for Tom for these last 25 minutes. You were, and Sarah for jumping on. Thank you so much.
Thank you, Sarah. Appreciate the backup.
Absolutely.
Right, guys. Enjoy the weekend.